Hi, I'm Dr. Sarah Nick-Rivon. I'm a cardiothoracic anesthesiologist, an intensivist, and also a point-of-care ultrasound specialist. And when I'm taking care of patients in the ICU or in the operating room, I'm trying to figure out oftentimes why they're hypotensive. A lot of our patients have cardiomyopathy, and there are different kinds of cardiomyopathy, whether it's septic cardiomyopathy, stress-induced cardiomyopathy, and we have to be able to support their cardiac function in order for them to recover. So what I'll usually do is I'll start by going to the presets and selecting the cardiac preset. And once I'm in the cardiac preset, I'm going to take the probe and put it in the third to fourth intercostal space with the orientation marker pointed towards the patient's right shoulder. This is going to give me the peristernal long axis view, and that is a really nice view for evaluation of the basilar portions of the left ventricle as well as the mid portions of the left ventricle. You shouldn't and can't see the apex in this view. You can also see the RV at the very top of the image, and what you're looking for is to see if the heart is thickening, if the walls are approximating each other, and the contractility looks good. If you think you see a contractility that's impaired, then you're going to want to proceed by going to look at the peristernal short axis view by rotating the probe orientation marker towards the patient's left shoulder. And once you're here at the left shoulder, you can start to scan down the heart. You're going to scan down the heart until you get kind of to the mid portions of the left ventricle, where you have the mid-papillary view of the left ventricle, and you're looking for thickening and approximation of the walls of the LV. In addition, you're going to look at the right ventricle to make sure that the right ventricle doesn't look big and dilated, because cardiomyopathy can affect either the left or the right side. And from here, you're going to scan down even further, and you're going to want to look at the apex of the heart. And when you're at the apex, you're looking for contractility here as well, because certain patients who have stress-induced cardiomyopathy develop Takotsubo's cardiomyopathy, which is a cardiomyopathy that basically spares, that causes ballooning of the apex. And the heart kind of looks like an octopus trap, and that's where it gets the name, is Takotsubo's is octopus trap in Japanese. So you're looking to see what the apex is doing. And if you see the apex is not contracting very well, and there's no other reason why that should be going on, then you want to consider Takotsubo's cardiomyopathy as the etiology of the patient's shock. And in just a couple of seconds, you have looked through the entire heart and determined how the heart is beating, and then you can direct care appropriately. And that's how I use the butterfly IQ when I'm in the ICU or the OR to try to treat my patients who are in shock.